Um, my name is Zamani bin Mahmud. I was an ex-government servant. I retired at the age of 58. That was in November 2010. Um, just 3 or 4 months before that, I found out that my health is not that good as usual. I mean that my appetite gone down, and slowly I'm losing weight uh, by the month. And in early November, I found out that I'm having a difficulty in breathing, okay, and not able to carry out the uh, exercise which I'm used to, such as jogging, cycling. So I thought it was a normal thing to me lah. And in mid-November, after going through a series of fever and whatnot, and one fine day, my nose started bleeding, and then I went to a medical institution for a checkup, and after a series of diagnosis, it was confirmed that I was having a problem with my blood, and I was referred to another medical institution, and I've gone through another thorough diagnosis, whereby it was confirmed that I'm having leukemia. And at this stage, I do not know what type of leukemia. I was warded for 3 days, and after going through all the CT scan, biopsies, it was confirmed that I'm having AML2.
How did you feel when you were first diagnosed with AML2?
Well, after having that knowledge of what cancer can do to your body, I feel a bit down, you know, and well, I accept the thing that it is one of those things I have to face it, you know, and so even my family accept it, that I'm having that thing, and the first thing in my mind was that well, it's a very what could I say, threatening, you know, and what I'm having in mind is okay, that's it, maybe I won't last long. That is after knowing the cancer. I don't know what stage it was. Okay, and I was referred to a government medical institution, and again the doctor confirmed is AML2, and at this stage, after discussion and whatnot, I was recommended to go 4 cycle of chemotherapy, and because of my cancer is at a very critical stage, I was given I have to go through the cycle immediately. I mean that very night. That was after a series of discussion, and you know what chemotherapy will do to you, how it will last. Well, since at that time I don't have any choice, so willingly I accept it.
How did you feel when you went through the chemotherapy?
Well, the first For the first cycle of chemotherapy, on the first 3 days, I feel very fine. Okay, I mean, just one of the medicine that I have to take. I mean, for the treatment. And after finishing the first cycle, I start feeling very weak. You know, I'm having fever on and off, and on and off I have a spike of fever, high fever, and you go through. I mean, we go through all the the first cycle for a week over there. And that first cycle lasts me about 30 over days without knowing whether it has improved the apa ni, slight.
So you didn't know how well the treatment
Yes.
going for you?
For what I know is I'm getting weaker and weaker as days go on. So after about 30 over days, I was given a week of medical leave, went back home, and I was called back to the medical institution to go for the second cycle. That was for another 7 days of chemotherapy, the second cycle. And from that stage on, it's getting worse and worse. I start losing my hair, and my skin turned dark, and I can't even walk. So after the first about 15 days, I was so weak that I was bedridden. I cannot do anything. My appetite start going down, and vomiting whenever you take your food. And have to face the thing for another 45 days or so. Besides that, almost every day, the doctor will take my blood sample, day and night. Then you have gone through the CT scan, the X-rays. Yeah. In fact, every 2 other days, they will do the X-ray to find out the lung, the whatnot. So, and all in all, I was warded for 6 months. Then I'm supposed to go for the third cycle after 6 months. But after a series of discussion, they found out that I was too weak to go for the third cycle, and in their opinion that my body cannot take anymore, and I willingly say, okay, that's it, stop the chemotherapy. So then after 1 week of not being given anything medical or what, my family was called, and I was sent back home. And at that time, I was informed that my days are numbered. Then only I knew that I was that the cancer thing has reached stage 4.
So the cancer has spread to other parts of your body?
Yeah.
Where?
In fact, they tried to to tackle my lung, my liver, and for the bones and whatnot.
So you mentioned that you had some pain on the right side of the body.
Yeah, during the course of treatment. And maybe because one of the side effects is all your bones and whatnot. It feels terrible pain. And I start mentioning about there was a pain in the right hand side of my stomach, and they suspect that there's a fast or something. So they recommended me to go surgery to remove the fast or whatever it is. But I refuse, because they themselves do not know what is the cause of the pain. So I was given the painkiller, which I took for about 3 or 4 days, and so after that the thing just subsidized, and I was very lucky that I didn't go for the surgery, because knowing that I'm a very high risk patient with the low blood level and whatnot, that very weak.
So, how long did you undergo the treatment in the hospital? And how many cycles?
I'm supposed to go for 4 cycles of chemotherapy, but as I said earlier, after going through the second cycle, I was so weak, and after discussion with the doctor, they said your body is too weak or what? It's too weak to go for the 3rd cycle. Maybe they have some other reason or what, because I was not informed, right? And when we were sent back home, that's it. When my family was told to take me to be discharged. So I went back home, and then until one fine day, this my daughter-in-law said, why not we seek for alternative treatment? So, knowing that your days are numbered and you are being discharged from hospital for whatever reason, so I'm willing to say, okay, why not we try? So that's how it started, the treatment with the Professor side.
So when you decided to go for the alternative, what did you do?
So when I was discharged from the medical institution, I was hoping that maybe there's some other ways and means for the treatment. And it happened that my daughter-in-law was at home. So she recommended me to go for the alternative treatment. And she recommended me one practitioner by the name of Syed Putra. After knowing that he has the knowledge, especially should I say the knowledge and know-how of cancer treatment. Well, being a man with knowing that your number of days are numbered, so I willingly said, why not? There's nothing to lose, when you are at the stage of illness. So that was in early June. I went to see Professor Syed, and the very first moment he saw me, he knew that I was in a very, very critical stage, because I was not able to walk I was being using, and he recommended me his medicine for the first, not even the first stage, but it is to support my to support what?
Weakness.
To boost up the strength and whatnot. And I was told to take the series of medicine immediately for that very night. So, okay, I've gone through the stage, and the next day I went for my blood test, and after that, with that result, went to see him again, and well, being a professional or through his experience, he just told me that I got a few days, in fact 5 days for survival. And then he recommended me to go for the fast track treatment. And before that, I must have 2 pint blood transfusion. And so immediately we went around through the medical institution, and sad to say that I was refused for whatever reason. And through the good networking of professor, I was able to get that 2 pint of blood in Putra Medical Center in Malacca. So after that blood transfusion, I start off with the treatment.
What was your first impression when you saw the 19-day protocol?
Well, at that time I do not know that the protocol or what. So after discussion with him, that he recommended me to go for the 19 days protocol. You know, as I said earlier, that well, that is the hope or the only, not the only hope, but it's an alternative treatment. So I willingly say, okay, we go through. Why not we try? So he recommended me a bucket full of medicine to be taken within 19 days, consisting of herbs and whatnot, you know. And I was being told that the first 5 days, it is a hell of a thing. It's correct enough. After taking the medicine, the second days, yeah, I was purging, vomiting every 1 hour or so, and beside that I have to take all the medicine. And the protocol was that it's about 50 or 60 over capsule within 1 hour, and the protocol lasts from 7 a.m. until 10 p.m. But I was not able to catch up with the time, but I still have to finish the thing. So you just imagine taking pill from 7 a.m. until right after 1 or 2 a.m. in the morning. That's because, you know, you have to follow the protocol very closely. It's a matter of survival at that time. You know? like it or not, you have to complete the day's course. So that's it. I went through that hell of a thing for 19 days. But after 1 week, I found that there's a great change in my energy, my breathing problem, and my appetite. It started to improve, and I was able to walk without any difficulty in breathing. And well, my appetite start growing. I'm able to take food. That's it.
The food, you had to pantang quite a lot of food.
Yes.
How was that for you?
As I said as well, we have to follow the protocol very closely, because it's a matter of your matter of life. I mean, and you want to survive or whatnot. So whatever the professor recommended, you have to follow closely. So I was on a very strict diet for that period of 19 days. There's no sugar, there is no protein, there is no low carbohydrate, no milk, nothing. All the protein is out. So on a very strict diet, and I follow that very closely.
Yeah, it's okay.
It's okay.
Very good, very.
No protein, no. It's more or less vegetarian, very strict vegetarian. No soya bean, no nothing, and plain water. That's for the 19 days. So after that 19 days, and in fact on the 21st day, 19, 20, 21st, yeah, I went back for the medical, I mean the blood test, and through the result, the overall picture of my blood is improved a lot, you know, and personally I feel much more better. My spirit is high, you know, because I'm able to take my food, and you know, there's a lot of difference, in fact, as compared to the conventional treatment, whereby you, as days goes on, you're getting weaker and weaker, your health becoming worse, you know, when you are not able to have your food and whatnot. And I was bedridden for so long, for nearly 2 months, because of the fever and whatnot. But the alternative treatment, there was no such thing as a high fever or what.
So, after completing the 19-day protocol,
Mm-hmm.
did you have to take some more to handle certain parts?
Well,
Or were you totally healed?
as I was having a stage 4. I mean, the cancer had gone to stage 4. So it has affected all the internal organ, especially the lung, liver, the pancreas. So I was recommended to be given the follow-up medicine. In fact, the leukemia, the AML2 is under control. It's improving, and the thing is, I have to tackle the internal organ, that is the heart, the liver. So, and I was given a series of another medicine. That was for another 6 months, and on a very strict diet again. The same thing goes on. There no protein in my diet. There's no sugar, no milk, and I willingly accept the thing and gone through all the protocol. And alhamdulillah, after 6 months, after going through the medical, the blood test again, I was finally confirmed that it was okay. Back to normal. The blood level, the hemoglobin, the white cell, and the blood cell, the red cell are all okay. After 6 months of rigid.
Is there anything that you would like to share with the cancer sufferers out there?
Yeah. After going through all those things, it is not the conventional treatment. It could be effective in certain ways, the conventional treatment, but not to everybody lah. Because I've gone through all the, I read a lot of article on this cancer thing and the treatment, The first thing is don't jump. Don't go straight to the conventional treatment. It is our choice or our choice, in fact, to go through or not to go through. And the best thing to do is to get the second or third opinion. Okay. Very sad to say this chemotherapy is such a terrible thing. Through my experience. And there are always other alternatives. Okay.
So Tuan Zamani, after undergoing the 90-day protocol, would you recommend this protocol to anyone else?
Yeah, because it is an alternative to the conventional protocol and whatever. And what I've gone through, the suffering and whatnot, and then being informed that my numbers of days are numbered. So there are always other means of treatment, and correct enough, God willing, I was given the chance, where I was recommended to Professor side to get the alternative treatment, and don't give up hope, and it's better to go through the alternative, the other alternative of treatment, not to stick to one. And God willing, you recover. That's what I am now. There's a lot of improvement in quality of life. I was able to do my normal thing, such as gardening, exercising, And the best thing is I was able to take all my favorite food again. I'm back to normal. That's it.